Dentistry could be rewarding in many different ways, but what makes a big difference is when patients are appreciative for the changes that I can make in their lives. And just as important as when the patients come into the office and they have treatment in the office here, when they leave, I want them to feel good about it. I want them to feel like they had a good experience.
It's a complete life-changing turnaround. We all have this vision of what we want our lives to be, how we want to live. And since this, I actually feel that I'm at least close. I'm at least headed in the right direction.
I don't want to sound silly, but it's like being born again. Like it's a whole new you. You look in the mirror and you see something different, something that you love. He's given that back to me.
It could be stressful for patients just to walk into the door. And one of the most important things is that they're welcomed and they're greeted and they feel like they're not a stranger.
So what I love about this office, this whole practice, is that I feel like I'm welcomed, I'm known, they remember me, I bring my whole family here. This is where we come because this is where we trust Dr. Beckwith.
Every time I came here, the people here were wonderful. When we started doing the work, it was very helpful, they're calming. And then we started talking about the procedures with Dr. Beckwith. He gave me many options of what he would like to do.
The other part that's fulfilling about dentistry is that it's not a static field. It's a constant changing field. Many of the things that we do today in dentistry, we didn't even talk about it, or it wasn't part of a mainstream education in dental school. So dentistry has evolved into a more predictable, better medicine than ever before.
I love technology, and one of the things that gave me a lot of comfort here was the level of technology. All of the tools used were state of the art.
The technology that they use here is amazing. I find it very interesting how using the digital, I don't know if it's a scanner or it actually comes up on the screen and I can see it as he's doing it, how precise it is.
I want people to understand that I'm looking at everything for them. I'm looking at their occlusion and their bite, the health of their gum line, the wear patterns of their teeth, the teeth themselves. It's a total package when they come to the practice, and if treatment is ever required for them, all of those things are taken into account.